Valley Healthcare District Board of Directors at 2:00. So first, if we can do the flag salute, I need to ask everybody else, can you do that for me?
Everybody please stand and join me in saluting our flag. Ready? Begin.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Those of you who would care to join me in the invocation, Heavenly Father, we just ask your presence on this Board of Directors meeting so that we can be guided in the proper decision-making and look forward to providing the services needed in the community. We ask these things in your name. Amen.
I have wheels on my chair.
That's Carrie's phone.
I'm in charge of wheels.
Oh, really?
Yeah.
That and it's not the same.
I'll sit next to you.
Okay, so
I'll sit next to you since nobody here.
next, we're gonna do the mission statement. We will provide high quality, efficient patient care services that respond to the community and provider needs. We will provide leadership in health promotion and education for our patients, residents, medical staff, employees, and community throughout the district. And now is going to be the time for any public comment.
Did we approve the agenda?
Oh, we didn't. And we on there till later. Okay, so, excuse me. So do I have, approval? I'll make a motion for approval of the agenda.
Just one comment before we,
Okay. Okay, Ross.
I had asked that letter from the employees be on the agenda and just want to clarify where it is on the agenda.
It is going to be with his report.
Perfect.
Yeah,
Okay.
thank you for bringing that up. Any other questions? First and second? No.
I'm glad it's sorry.
Thank you, Greg. So back to public comment.
Vote.
Oh, shoot, guys, I know I should have stayed at my nap. We're all here, so all in favor?
Aye.
And I'm a yes, so moved. Thank you. If you guys are okay, I'm gonna go tumble on it, all right? Sure. This portion of the meeting is reserved for persons to address the board on any matter not on this agenda, but under the jurisdiction of the board. They may ask a question for clarification, make a referral to staff for factual information, or request staff to report back to the board at a later meeting. Also, the board may take action to direct the staff to place a matter of business on a future agenda. The board cannot take action on any items not listed on the agenda for actions. Speakers are limited to 3 minutes. And please state your name before making any comments. Is there anyone on or in the room that wants to make?
I prepared a little tweet.
Okay, can you state your name before you start?
Absolutely, that's at the top.
Okay, thanks.
My name is Kelly Joy Brown Linus. I'm a low-level employee here in an unofficial capacity to advocate for my coworkers and their concerns. Last week, I sent most of you a 12-page document. It started as feedback that I was going to submit on the KVHD intranet. I asked my coworkers for their input. I asked, what do you think could be done to improve the hospital? Which concerns have you previously voiced that you feel have been ignored or dismissed? These are not just the opinions of a select few disgruntled employees. There's consensus among the employees, and most of our concerns have been previously submitted through the proper channels. I tried to remain as accurate as possible when expressing their opinions. I have only worked here 2 years, but I have formed relationships with inspiring individuals in every department and learned more from them than I ever expected. I chose to work at this hospital because of the availability of continuing education and the hands-on experience that I could get in multiple departments as a phlebotomist and lab tech. A majority of the staff that I've spoken with feels that their questions and concerns have been largely dismissed. They brought up workplace safety issues, patient safety issues, maintenance issues, dietary issues, education and training gaps, and systemic organizational issues. Most of us are frustrated with the American medical industrial complex as a whole. We do not expect management to solve insurance issues or nationwide shortages. Instead, employees want to be involved in bettering the hospital for their community and their patients. We would like to be represented at every board meeting to streamline communication. A monthly staff meeting with the CEO to voice concerns will address issues before they become problems. We would like to be kept informed of the specific actions that are being taken to address our concerns, and we would like to see follow through instead of the standard response of sorry, we'll work on it. The staff want to be able to take pride in their work, and they want to be able to maintain their lives outside of work. I appreciate the response that was shared yesterday. I'm personally excited to hear more about many of the upcoming changes. Last week, I watched the last board meeting, and it appeared that some of our concerns were already being addressed behind the scenes. Effective communication does not trickle down through executive levels, department heads, and managers. Hope is the antidote to despair. I have hope that collaboration and clear and constant communication will ensure a better hospital as possible. Thank you.
Thank you. Thank you. So first of all, let me, well, thank you for coming forward with your comments. We will be addressing those things during the CEO's report instead of, I didn't have it put on separately because I knew we were going to discuss it. And so we're just going to go through the rest of the stuff, approve the minutes and those things that need action on, and then we will go to the CFO report. Okay? So, does anybody have any concerns on the agenda? Any of the reports? Oh, yeah, was there any more public comments? Oh, no, like raise their hands. You guys, do you have any? No? Okay. None, and no one's on that, so it's us. Most of these things, the contracts, the product line summary, these things, have all been discussed at the prior, committee meetings. So I ask that if there's no other concerns or questions that we just, approve it like we did earlier, it was approved and ready to go. So I did, appreciate the stuff that was when I went through the reports, because I wasn't actually at the last meeting personally, but I enjoy reading the reports that you guys put. I think when you do write your reports, they seem more recently, they seem more concise, because now we're not just reiterating the same thing we had discussed the month before, the month before that. It's like everything's current, and I think it saves a lot of time personally. I hope the rest of the board members feel that way. I don't always fall asleep reading them, so I appreciate that. Just putting that out there. Okay. Okay, if there's, yeah,
I'd like to pull item 13, the facility project update.
okay.
And I don't need you to stick around, Bob, if you have things where you need to be. My question is going to be regarding the pharmacy expansion.
Okay.
Oh. I'd like to
So,
discuss that.
okay, so we will move that to new business. Anything from anybody else?
Second, number 5 on new business.
Yes. It goes to 5. And
Yeah, 5 on new business. Okay, with that said, we will move on
Got it. Oh,
to vote.
Make a motion to approve the consent agenda minus item number 13.
Do I have a second?
I'll second.
All in favor?
Aye.
Thank you. So now we will, Move to reports. And Tim, you are up.
The update on the VA situation, I attended a breakfast meeting at the VFW this morning, introducing the fact that with our signing of the tri-west agreement for the VA, it now allows us the opportunity to be able to start seeing VA members in our clinics, in our hospital, and so forth. So we presented that to a number of the veterans this morning that showed up. They were very pleased to hear that. The number of questions that came and so forth. And so again, that was effective June or July 1st, January, that they were able to do that. And so we'll be sitting down with Jose Lopez, who is the Kern County Veteran Services Officer, who works with the VA, and we'll be sitting down within the next 2 weeks to discuss coordination of details and how that's going to work, because there's some other plans, community service plans, agreements within the VA, and how they interact with us, because some of those require that the VA member goes to their VA physician, gets a referral from the VA physician to a provider up here, and then our provider up here can see them. That applies to one specific plan. So there's a couple of different iterations of services that they offer. But the Tri-West plan, as was discussed with us, basically allows the opportunity to be all both Department of Defense people as well as the retirees and civilians and things like that. So it was like I said, we shared that this has been 3 years in the making of trying to get this thing through and allow services up here. As you're aware, a lot of this started with the fact that the VA wanted to bring their own team of people up here in order to see their patients. When we spoke to them about that, it made no sense because you're now taking those people out of their own service areas, and people now learning about it down there. And finally, they got some people in those positions who agreed that made a lot of sense. So
How are we being paid for that, Tim?
it's a managed care contract, just like any of our other managed care contracts.
So it's
John and I
not-
went through. Yeah, the annual working helped us.
So
with
it's
that.
worth it.
Yes, yeah. So, and that covers for our inpatient, it covers for our SNF, it covers for outpatient, physician services, and so forth. So they can be seen in our clinic, they can be seen, yes.
Is this gonna still require an authorization?
That's what we're working through. So I'll include you in these meetings. You'll be a critical portion of that. So when we meet with Jose, yeah, in terms of how we do all that stuff. But that's the part that we, again, getting the authorization to do this, working through the rates and everything else. But the actual nuts and bolts of how we make that work, and they've basically been bending over backwards, telling us if there's any questions or issues with billing, please call us right away. We will take care of them promptly.
Could you please make sure that WO is included?
Absolutely. So anyways, so just very excited to have that happen. Like I said, the members also seem very excited to be able to come here instead of having to call. We'd have a Bakersfield for certain primary services and things like that, or down to LA. And so this was a good step forward. So very happy with that.
Tim, can I ask a quick question?
Sure.
Because they have to have prior authorization and it's gonna be through the VA also.
Yes.
So they have to get it from the trainer, so authorization.
That's the part.
You're working on.
Yeah.
I just was curious,
Yeah.
how long would that delay, care for that?
The issue with this contract is supposed to cut through a lot of that red tape, to basically allow them to come to the hospital. This has been done in a number of communities already. And so this is one of the reasons they're going that route, because they realize it was taking way too long to get services and people were going without. And so that then, like they were dealing with much more costly solutions to their care needs and so forth. And so this is ideal what they want to do. And the thought here locally was, again, that this is a model it's not even in Ridgecrest yet, even though they have a military base out there. The thought was that we could develop this here within this community, that we would then be able to transport this process to other communities as well. to provide services out there to those vets. So, we're kind of in on the front end of some of this.
That's good.
So, yeah, so anyway, we'll keep you apprised of how that's going. Again, I want to reach out and thank Vince Wong for his support with this and Samantha Mitchell, from his staff. Alan Trin, who is the, the person we were dealing with the last time, last two times, that we met with him. Basically his, step down from his role is now in a different capacity. And was now taken over. Alan is the person who's over all the VA clinics throughout Southern California. And so he called me to set up a meeting and said, my job is to make these things happen and so forth. And I said, that is such a refreshing response. He kind of was familiar with the history and just said, no, this is why we're doing this. He says, if you've already got the Tri-West agreement, he said, you're good, you're golden. He said, we can get started on that really fast. So, and like I said, he actually gave me his personal cell phone number and just said, if there's any issues, call me. That's the only phone I have. So he said, it gets answered every time because my wife calls me on that phone. So he just said, you will get a response. So again, we're just very happy to finally get the group together that is willing to make this happen for the community. And like I said, we've got about 900 veterans up here in the valley. Like I said, the ones we met with, we're very anxious to see this happen. So,
Well, just a question.
yeah.
So when you get the details worked out,
Yeah.
how they actually access services, how are we gonna alert everybody?
We are going to do a marketing thing to them. The VA is going to be a part of that
Okay,
as well, to reach out to their members
great.
and so forth. They're excited.
Do we know who they are locally?
They do.
Okay,
Yes.
all right,
So they have all of that.
perfect. Great.
Can Sherry have that phone number too? Just asking.
Oh, I'm sure. So anyway, so yeah, it was great. I started having meetings this week with, something we had planned before the holidays. To start meeting with the departments. I met on Monday morning with the SNF staff. It's kind of like coffee with the CEO kind of thing. And so had some great comments and feedback from the SNF people. I've got another one going this Friday morning with the other half of the staff down there. And we're gonna be working to set up meetings with all the departments within the hospital so that we can sit down. One of the things we found is like I said, before held meetings, where we've asked people to come down and meet with us down in the cafeteria or whatever. And invariably, a lot of people don't show up primarily because they don't want to be raising issues in front of other departments or things like that because they're maybe just afraid to say things. Where we've gotten the best turnaround on some of these things is where we've actually gone into the department and discussed with the staff there because it's an environment they're comfortable working with, and talk to these people all day long. And so forth. And so that was really the strategy behind setting up these meetings. So, I will report back out as to how these things are going and some of the key issues or concerns that they're raising, just so we can all stay focused on that. In the SNP, for example, some of the things they talked about was staffing. Obviously, we have one wing, wing one, or hall one, that has much higher concentration of the heavy need patients on that unit and so forth. And so we obviously need more CNAs on that side. We talked about redistributing some of that load to some of the other areas in order to kind of balance the load a little bit. Because some of the staff obviously that work that wing or that hall work a heck of a lot harder than the others. And so staff was really happy to see that we were willing to talk about that. We also talked about need for some computers in there because of issues associated with their ability to chart timely because of the sharing of, again, that there's our ends and LVNs kind of sit around in the desk area where the computers are. But they said if we had like an iPad or something like that, we can do our charting while we get a moment and stuff like that. I said, that's cheap, that's easy. So I presented that to Carrie, and Carrie's going to be meeting with them to find out specifically what they need and how many, and we'll go ahead and take care of that.
And we do have 2 more of those flip down charting stations for computers in storage.
Yeah, I think the plan is to, with point-click care, CNA charting can be done on iOS, iPads, devices. And so, we ordered one, or are ordering one today. We're gonna order one just to make sure this is what everybody wants. And then if it is, I think we'll get a total of 4 that way. CNAs.
Yeah, and that might be good the way we're just saying is we still do have, there's really never installed.
Right. The other things too we talked about was the need for bed carts. We looked at them some time ago, not yet made a decision as to which one we want to do. So we want to come back and revisit that. So we said. So that's the kind of thing that we really want to hear from them on and so forth. And again, I recognize some of this stuff as things that, like I said, the letter that we got addressed. Unfortunately, it was a timing issue on this stuff, but
Tim,
good.
I don't know if this is the place, but it's sort of, we always had a front table.
Mhm.
And we had a lot of chairs and then the public felt invited. Right now, the way it's set up, we're like an afterthought.
Yeah.
And, that's their meeting.
Glad you brought, I was gonna bring it up in my board comments. I feel the same way. I'm sorry to interrupt.
Yeah, no, it's okay.
I just feel when the public is here, we're elected public officials, we need to be facing them and give their, this is how I feel.
And we can have the calendar where it's on them when they're
Sure.
trying to speak and then on us when we're speaking.
It's not an
I
issue.
mean, it's not an
Yeah.
issue, right?
No, I mean, that's why
That
the
would-
tables are back there, because that's how we made the bend in the table to better address the community. Like I said, rarely do we have community show up at the meetings and so
Well,
forth.
it seems like we're going to have
Yeah,
some more.
hopefully we will. And, like I said, yeah, we can do that. Absolutely. Like I said, for so many years, we did it that way. So this was just set up this way more for committee meetings, don't we meetings, so it's easier to do. What else? We are working on finalizing the parity adjustments for the staff. We finally received all the feedback from the managers in terms of their recommendations for adjustments. So we will be meeting with that early next week for the exec team to kind of go through those and finalize those suggestions. Those will then go to the policy and personnel and policy committee to review those with them to make sure that they're in agreement with what we're proposing. And then obviously for the board for final approval before those are implemented to the staff. Again, there's been a number of changes that have been made because of, just the economics in the communities. Like I said, one of the things that hit us just this last year that we started in June was this mandatory, large mandatory minimum wage adjustment. We've obviously had minimum wage adjustments for the last 5, 6, 7 years, but they were smaller, 75 cents an hour, $1 an hour, things like that. This last one was several dollars an hour. And what happened is obviously as we implemented those, we saw significant compression being created on the middle and the upper level salaries. And so, parity really is an opportunity for us to go back and re-look at where those positions are in comparison to the community and make adjustments on those. And so that's what we're putting together. That'll come back through to the board to review that. But the idea is to get us back to a position where our rates are compatible and competitive with the community so that it improves our opportunity to hire staff that have experience and stuff like that. So that's underway. We're also creating new salary ranges for all of the positions that are reflective of market demands and conditions. So that's going right along with that. So those haven't been adjusted for a while.
Now, you're talking about management?
No, all in place.
Okay.
That's all in place.
Because management, I think the board should look at that.
Well, you'll see everything. It's all in there. Because it's by position. So. We're also creating, like I said, I think we're working on a new managed care contract agreement with Universal Care. Thank Sherry for bringing this up to us. Apparently we had a patient in physical therapy the other day that came in with that plan out of Bakersfield and so forth. So we've got Andy working on that right away, trying to get us a new contract with them. So, and so that's it. And the last thing really I wanted to talk about was this letter from the staff. We received a letter from some staff with a wide range of concerns regarding the hospital. It covered issues with staffing, pay, benefits, nutrition services, housekeeping, maintenance, a whole host of issues. The administrative team took that the other day, and created responses for virtually all of those items. Primarily the one we wanted to time in getting back to the staff, because we do want to hear from them. Again, I appreciate your comments, Kelly, with regards to feelings that some people haven't been heard, or that some of these have come up in past and no actions have been taken. Again, a lot of this stuff is, if they come through the proper channel, we can all make sure this gets handled. And we're very open to having open dialogue with our staff. It's the only way we can accomplish anything. So just understand that's what's going to happen, okay? There were a lot of the items that were in there. There were some good items that were in there with regards to suggestions that we can make some changes to. Those are being worked on. We called in all of the managers from the departments that were identified within in that letter. Had discussions with them, got their feedback on changes and things that need to be done within their departments. Their responses were in there as well. And so some of them, like I said, are things that we can fix right away. Others are things that may take a while to pull together. And so that's what we're working on. It's just, and conversely, some of the items that were in there were things that did not have merit. I will say it that way. Some were factually inaccurate. For example, there was comments in there that all of our nurses in the ER should have ALS or have PALS training and those kinds of things. It's a requirement for any nurse that works in there to have those. There was a question, another comment that the hospital should pay for those things. The hospital does pay for those. As a matter of fact, the hospital encourages all of our nurses, even on the acute unit, to go and get that training, because obviously it betters us the more people we have trained. And we pay for that, even though it's not required of them. So there's things like that that are in there. I think there may have just been some misunderstandings about what we do provide or not provide. So we wanted to use the document. We responded back to them last night with updates. So we wanted to provide it from an educational perspective, because maybe there's some people here that just don't know, what our history was or what we do provide or whatever.
Or that they could get reimbursed. Maybe they took it or something and didn't realize that. So
anyway, yeah. So, and that's what we kind of chose to do with this. Again, in no way, shape, or form did we want to go back. There was no attack or whatever. Again, maybe it didn't quite go through proper channels, but in spite of that, we wanted to hear that. There were some good things, like I said, that we are going to respond to. I think the one thing, the letter claimed to frame the responses from an unbiased and respectful manner. I have to disagree. And that's a personal thing, okay? A number of these were done from a perspective of an attack on the managers and so forth. I've gotten considerable feedback from the staff, highly upset with the letter and how things were framed. And we're basically telling folks, just, okay, thank you for getting back to us. They appreciated the way we responded to this. And like I said, we've got to get beyond this. I think one of the things the letter spoke to is about respect. And the point is, we all have to respect each other. This is a team, and we all work together as a team. Every member of that team is important, because we rely on the talents of everybody that works here in order to make this place work. And if we don't, it won't work. And so, like I said, it is my hope, and like I said, we're going to set that example, that there is that level of respect within the organization. And like I said, I commit, I will work with the staff. I've always said that. I mean, Mark and I would go to our orientation meetings for the new employees, and we would tell everyone we have an open door policy. Anytime, as long as the door's closed, there's someone to beat you to it. But other than that, come in, talk to us. We want to hear from you. Because everybody assumes that we know everything that's going on. We all have very busy agendas. You know, we're all working on a lot of things, you know. Um, people think administration just sits in there and they talk and they don't do anything. Nothing further from the truth, you know. The bottom line is that we're all working on things to help the hospital get better. And so, like I said, so we need to hear that comment and feedback. We will continue to solicit that, work with them. Like I said, I'm gonna be going around and meeting with every department, and so forth to talk about these items and issues, and anything else they want to talk about. But like I said, you know, we're working on a whole host of things. One of the things, like I said, I'm working on right now, is a residency program, family practice residency program for the hospital. This would be in concert with San Martin Hospital and Sierra View Medical Center. They want to rotate, any of these residency programs have a need to provide a rural component to their education. They want to use this as that education site for the rural care. And they want that experience to come to our clinic. They also want a good portion of that to come from our emergency department. So one of the things it does, it actually provides an extra set of hands and eyes within the emergency department to help our physicians, especially on evening and night shift, because they have to work all hours of the shift to get that sense of what's happening within the hospital. They have to know how to do that. And so I think it's a great opportunity for us. But just, you know, again, some of the things, like I said, we're constantly working, even though maybe people don't see all that at the time. It takes time to develop a lot of these things. But that is always going on. We're always looking at these opportunities and so forth. So anyway, we're going to work in earnest to address every one of these conditions and constantly improve conditions where appropriate. Some, like I said, some things we can do, some things we can't do. You'll explain why in those cases. You know, hopefully everybody understands that. But you know, again, I think there was a number of comments that were made about an uncaring and administration and stuff like that. You know, without you coming and talking to me or getting to even know me, I have problems with that statement. Because, you know, I've been up here through the fires and stuff like that, stayed over the spent the night here, you know, to make sure that the staff were okay. In the event we had to go back to it. You know, these comments are just not appreciated and unnecessary. So like I said, I think this is part of keeping the respect issue here. And like I said, that's what we want to do. Every one of us is important.
But I think something,
Yes, sir.
what you're doing right now is a really good thing, to run around talking to everyone.
Yeah.
But why did you have to get in the position you're in? Why haven't you been doing that? That's part of your job, is to know what's going on, to deal with people, see how they're, what's going on. You should know, you should live and breathe this hospital. I mean, you're the person. So do you have a plan to keep doing it, or? You
Yes.
just-
Well, this is not a one-time thing. This is gonna be an ongoing thing. And I did this years before. Like I said, things changed, stuff like this. People stopped coming to the meetings and so forth. So I said, okay, great, we'll take a break for a while and we'll see how things
I
go.
wouldn't stop one.
No. Well, no, you.
And
You can come anytime you want to.
in Tim's defense here, this idea of this copy of the CEO, Mark, we discussed this in November. We decided to roll it out at the beginning of the year, so that wasn't a result of this whatsoever.
Yeah,
The wheels were in motion before this meeting.
Yeah, now we know it's important. Like I said, it's just, like I said, we have a lot of stuff going on and so forth. We do speak with the managers. As a matter of fact, one of the things, like I said, I'm doing as the first of the year is now requiring monthly meetings with each of the managers. We primarily left it to the managers to decide. Some come routinely just to keep us apprised of what's going on. Others, you know, they're working managers, whatever, the departments. And if there's been issues or concerns, then come see me. You know, or sometimes they'll do it through emails or whatever works better for them. But, you know, again, I think because of what we've seen and so forth the last year or so, I want to start having face-to-face with them at least once a month. Just even if it's a 10 to 15 minute meeting, just to hear them, see them, you know, let them know what's going on. All right.
One of the things that we implemented probably 6 months ago for the managers' meetings, we decided to change the format of that meeting and start going around the room and having the managers discuss their issues prior to us talking, or kind of we're giving them the opportunity to express their issues and concerns that they have. And I think that's worked out well. I try to remind everybody, hey, the manager's meeting's coming up. Be sure you have things available. And sometimes people, they don't have things to say, but sometimes there's good dialogue. So I think that has been effective, as far as
Yeah,
the manager's meetings.
and sometimes there's a big, on those meetings before, we would get on a roll, talk about what we're doing here at the hospital, but we find out we got 15 minutes to go around the room.
No time
But
left.
now we go around the room first and then we do our class, so.
Sure.
Yeah, so when are these CEO meetings begin?
They started Monday, and so I've got another one coming up Friday. If you want to get with me, come to your staff, and stuff like that, be happy, just get a hold of Heidi. I'm trying to get.
Started Monday.
Yeah.
And then as far as the managers meetings go, I think maybe for some of the managers, some of the issues that they may have may not be appropriate for the managers.
Yeah.
Okay, we need that.
I'm only speaking from personal experience, so.
We know you've never been shy.
Thank you.
One thing, if I can make a quick, well, I don't make a quick anything, but, I want to reiterate that since I've been on the board and I've worked here, I've worked here a total of probably, I don't know, 14, 15 years. I come and go, I keep retiring and calling it good, but here I am. But, and I just want you to know that there are things that go on that you'd be surprised of who knows and who doesn't. I've been humiliated in this room myself. And, totally humiliated. And, Jim never even knew about it. But yet, it was in a room full of managers. So we don't always speak up until we're so frustrated that when we speak up, it's, I don't think we take into consideration that, okay, let me just step back.
You're speaking with your emotions and not.
Yeah, let me just step back. Let me take a look at it. Let me, in my case, pray about it and then move on. And, reread it or whatever. But, one of the things that I want everyone to know that are employees here, you're still part of our community. We are here to represent you. If you're not comfortable going to your manager, you're not comfortable going to Tim, you go to one of the board members because we're here for you. Literally, we are here because you guys in the community elected us. And I appreciate receiving all the information that Kelly set out and stuff because I read it and I reread it and there was things I saw that, I just laid in the bed in ER 4 hours from start to finish. I was so impressed and ready to go home. But there's things you notice when you walk through and other people don't see it. But it stands out to you because this is like walking through your home. I had a housekeeper for a while. And she was the best, but she looks at cobwebs, I look at baseboards. So we had two different in-betweens that, she if the cobwebs are down, then everything looks better. And I'm thinking if, the baseboards are wiped off, everything looks better. So we have two totally different, plus there was a hole in between, but it's just, what do you look for? What has happened or what has been put into your life or what has you've been taught from parents or from anybody else? What do you look for? Dust bunnies, I agree, please do not come to my house. I have 6 dogs, so they're bigger than dust bunnies. But contact a board member. We are here for you. And if you're not comfortable going to, like I said, sometimes it's a personal issue with either the manager, maybe it's a personal issue with someone that's in the same department or another department. You can always come to the board. All
I
right.
think the important part is to follow the chain. Like I said, if we're not responsive, then not to the board. The board has no problem calling me. I'll tell you, and trust me, we can respond. But like I said, there needs to be a process, obviously, that we try to get this resolved internally, without having to get to that point. But
Well,
it's always.
and that's true,
Yeah.
but we're here to support them too. We
Absolutely.
can come alongside of them, anybody in the community
Sure.
and any of the employees. And sometimes, let's face it, the executive team is what? How many males, how many females?
Forward to.
Well, I'm trying to standard.
So, yeah, so, maybe there's something that they don't feel comfortable discussing with one of them. That's why I again want to reiterate, we're here for you guys. So, and the other thing I learned is being on the board is things don't happen fast. Building committees and waiting for.
Being serious, they didn't give only what you said.
It takes time. Everything turns slow. Yeah, because I never realized how many things have to get approved before you can go to the next level, before you can buy stuff, and then you gotta get it approved. But we want to work faster for you guys, so I just wanted to, sorry, I jumped on your bandwagon, but I appreciate everybody being here. Yes.
Hi, my name's Danielle Walls, and I'm one of the nurses for the hospital. This is my second time coming back to KVHD to be employed. The first thing I want to say is to the board is that I'm glad to hear that you brought up that you are elected officials and that you are the community, because you are. And you're our first defense when it comes to the community. And I hope that you each individually understand the importance of that. This manifesto was not brought lightly to the board or to our administration. I don't think it was disrespectful. I think Kelly Joy did an amazing job at trying to get everybody's voice and put it together in a way that was as respectful as she could put it. You have to understand, this is now at a point where the employees were done, that they felt that they had gone to their administration numerous times, that they had offered suggestions and ideas, and were shut down. Okay, so I want you to understand how frustrated they felt in this. I think all of us understand that the Saturday night that we had to close the ER was horrific. My understanding is that it had never occurred at the hospital before in all the years that it's been here. And it was devastating, not only for the community, but for the staff to not be able to take care of their community. And then to hear the backlash in the community against us was devastating for me, particularly because I was pointed out specifically on a patient that was irate and did not understand the full ramifications, or not ramifications, but the full understanding of how that decision came to be. I don't think Tim took it lightly in closing down this ER. I also, and I think Deb Hess did a wonderful job posting a PSA on the KVHD website and the Kern Valley News and Info. And for the community, and I understand their frustration, they have nowhere else to go for healthcare but here. And we are privileged to have a hospital here. I truly believe that with all that I am. But I also believe as a board and as the community members, we need to be held to a higher standard of healthcare here. Even just because we're small doesn't mean we can't do great things. And I understand that you and the administration are trying their best But some of these things that we're asking are not huge changes. They're not things that should take months and months and months to change. For example, and I understand this morning an email went out or an explanation was given about doing a potential on-call for the nursing staff. That's a wonderful idea. I fully support that. But these are things that I don't necessarily, and I don't mean any disrespect, but why does the board have to approve that? Why can't administration just say we're in a critical crisis need? Much equivalent to the COVID situation. And at one point we were told, well, this is just COVID burnout, post-COVID burnout. No, this has nothing to do with COVID. This has to do with everything in the fact that these employees did not feel heard and they didn't know what else to do. And Kelly Joy was gracious enough to professionally put something together. Now, maybe you don't agree that it went through the right channels, but it was because we felt like our channels were not being heard. And that's all. It wasn't meant out of disrespect. I have always, Mark has always told me, Tim has told me, and I have been in their office numerous times with concerns or suggestions, and they have listened. I'm not going to say they haven't, but when you go months or years of hearing the same reply and not seeing anything change, it just gets disheartening. But I want to thank the board for recognizing that you are members of the community and you are there to represent us. And I just hope that you understand the importance that we see in that.
You know what, I think, I'm not gonna speak for the whole board, but kind of. I understand that, and we do feel your frustration. You know, when I worked here, I had plenty of frustrations, but. And nobody meant disrespect, but when you're kind of pointed at, you get defensive, bottom line. You know, whether we mean it to be that way, we take it personal, just like you guys take your stuff personal. So there's no way we can remove that human, issue out of it. We appreciate everything you're doing. I'm so appreciative that you guys are here today, and we do hear you. We do hear you. And we had already started working on stuff. We're here to support, our administration, but we're here to support you guys too. Now coming, to the middle of things and trying to work everything out, it's going to depend on all of us. I told him, do you want me to go buy 12 plungers and put a ribbon on them and give them to every department? What can I do? I was on the phone quite a bit with Tim that night about the ER closing. And I don't know how many other board members, because we really can't talk to each other unless we're in this room about anything with the hospital. So that's really tough on us. I mean, we can go hang out at dinner or do something, but we cannot discuss anything going on with the hospital. So that's hard for us. You can talk to one, but that's it. If you talk to one, you can't talk to any other one because of Brown Act. So that puts a limit on us, which is fine. That's the way the law is written, but it does take a little more time because then to discuss it, we all have to be in this type of setting. So, but we can call an emergency meeting at any time. So if there's anything that you've got something going on and you contact one of us or Tim, we can set that meeting up. So I just want you to know that. So we don't take it. Yes, we all felt kind of, I don't know if it was totally disrespect, but maybe hurt too, because it's like we're failing. I mean, I took it that way when I was reading it. I was like, again, dust bunnies, let me get you a plunger, let me do whatever. So everybody has one. But I just want you guys to know that I know everybody on the board wants to meet their needs, wants to see the hospital grow. And we depend on you. The community depends on you. So, yeah, it could have been taken disrespectful, inappropriate, could have, but again, we know it comes from the heart. And personally, anybody can take anything. That's what's hard about texting even. You can read into it whatever you want. So anyway, but I do want you to know that we do appreciate you guys and what you've done. Okay? Sorry.
Thank you. That's my report.
Hi. Hi. So I'm Tiffany. I represent obviously the cafeteria, dietary, nutrition services, whatever you want to call us, but just representing my department and their voice, I wanted to at least say something. My staff saw this document on Sunday in the cafe and they were just appalled by it because, as most of you all know, there were many pages about my department. And we all eat, we're all cooks at home. We all have some level of, we like this, you like that, even our residents and patients. Everyone has dislikes, likes, preferences, beverage preferences, right? Everyone's different. How we grew up, maybe your mom makes the best lasagna and you think ours is horrible, but everyone else loves it. Food is personal. Being in the setting that we're at, we are a rural facility. We need to also remember that we have a hard time hiring people. Our retention in the kitchen is amazing. My staff love their job and seeing this. It is an attack on them. It's an attack on every one of us that work here every day who spend 80 hours here, maybe even more than that, and dedicate our life to this facility. And it is hurtful. To say that other departments feel like they're at the bottom. I know my department feels like they're at the bottom just as much as CNAs do. Maybe maintenance and housekeeping too, the jobs that are, blue collar jobs, and everyone's essential, just as important as a nurse. But I think just a lot of the information it was a lot of misinformation for my department, unprofessional, biased opinions that are someone's opinion. On how I responded back. We have so many guidelines and regulations that we follow, not just from the federal, but from state, from the county. We get inspected all the time and we get rave reviews. We just had our, the sniff and state inspection. There were no citations in the department. So clearly that says something about what we do. Yes, maybe you may not like the food in the cafe, but the number of the people that we serve are our patients and our residents. And we have so many strict guidelines on sodium, on following diabetic diets. And people are so often, I feel like, to always just criticize and blame and condemn someone and not realize that maybe that doesn't look like a diabetic meal. But it is a diabetic meal. And why is everyone always so quick to judge and blame my staff that it isn't when they don't know how it was made? That cake was actually made with Splenda and not sugar. But when you see it, you're quick to judge that why they get cake. They're diabetic. People don't realize it. I can't talk about a nurse's job like what Mark does. I'm not a nurse. And no one else is in my department. There's only one dietitian here. So it's hard to talk about something else when you're not in their shoes, walking in it, seeing the frustrations, hearing people other out. So that's just kind of where I'm coming from. And hopefully from this, people can go to the right channel and feel more open-minded to hearing comments and then explaining stuff like, this is why it is because of this. Don't just think we're doing it for some untrue reason, but come and ask us why we've made this change or if there is a concern, but realizing we can't do everything. We have limited resources in the kitchen, and we're always trying to improve and make changes, but we have to assess them and see if they're feasible at the end of the day. Thank you.
Thank you, Tiffany.
And again, you're to kind of close here a little bit, again, it gets back to the fact that, it's all about respect and communications. Again, my comments directly unbiased or, biased or whatever, wasn't directed at you. I mean, it really was some of the nature of how the questions were answered or put out. Okay, and it's just like I said, but the whole point gets back to my comment with regards to the fact that we have to have unilateral respect. We all have to work together. We have to listen to each other and talk to each other, hear each other, so that we can fully understand what the vision is. So I thank you for this. Like I said, it's a stepping stone moving forward. So.
May I respond to that?
Sure.
Okay, my effort was just to express other people's opinions in an anonymous way where they couldn't have any kind of backlash against them. So those opinions are not my personal opinions. I just want to clarify that. I just took the feedback to the questions that I asked and put it in a document. And so I know that that's not my job, and I know that I have gone to my manager before with a lot of concerns like this, and a lot of their departments that I spoke to have talked to their managers and department heads about these issues. So I would love to continue, trying to use that chain of command, but I really do not think that it has been as effective as it should be.
And again, I think
Yeah.
the way the chain of command is again, if you don't get the answer you're looking for, you don't feel it's being heard or whatever, go to the next level.
Yeah.
And step up from there. And so, like I said, because I can tell you a lot of these things have not been personally brought to me.
Mhm.
Okay, so my point is my door is open. This is a new day going forward. We're gonna set some new things in place to make sure that we have that dialogue going with our staff, because we want to hear everybody. We can't make it better. We don't know what's going on. And I thank you for that.
There's always sack lunches.
Okay.
Sorry. I used to bring a lot of sack.
I have-
Sherry?
I think that like going forward, if you have departments coming to you with certain concerns, and one of the comments was that when that is done, the employee or the managers, oh, we'll take care of it, then there's no action. So,
Or there may be no perceived action because it takes time, as we said, to solve some things, but that's
yeah,
a
well, I'm
valid.
personally speaking from having my department remodeled, it took 3 years.
Yeah.
I had to get a board member involved. So I'm just saying that if you say you're gonna do something, then that's what should be done.
Yeah.
And if you can't, then that should be explained.
Thank you, Sherry.
That's my response.
Okay, any other questions before we move on? Oh, we have a couple.
Do we have opportunity for board members to comment?
Yeah,
I hope so.
Okay, I don't want to close this down without. I want to share my perspective on this. I applaud your initiative for collecting these up and bringing them to our attention. I hope that in the future, your tactics are a little different. I don't think it was fair to our CEO to do the sneak attack, this public attack. Basically put a big black mark on this institution without him first being able to look over that and respond. So I hope in the future, your tactics are a little different. From my perspective, and I think I speak for the whole board in saying this, we deeply respect and admire the staff. We want you to be happy to work here. Your job satisfaction goes directly to patient care. We want our community cared for greatly. We want you to be satisfied and rewarded appropriately. So I think we're on the same page.
Yeah.
I just hope that you can do better on your part to communicate with our CEO. And you can do your part in listening to the concerns of our staff. I hope that you can basically take this 12-page document, distill it down to things that have been identified. And, identify the ones that are inaccurate, move that to these seem to be false claims. And then let's start working on that other
And
list.
some of our response was directly towards that, because like I said, where maybe people didn't have the information, we used it as an opportunity to educate.
Yeah.
So, and like I said, and hopefully that's out. We're done with that.
I thought
So
your
there's-
reply was spot on, and I thought you did a very good job. I just don't want to see this get set aside and not talked about again.
No, like I said, there are certain events that are eye-opening events, okay? It's like I said, this is not unique to this hospital. I've managed a number of hospitals and I've talked to a lot of CEOs, especially, we were supposed to have a meeting last night with all the CEOs. So I meet once a month with all the CEOs in Turner County. And we talk about these kinds of issues and so forth. Everyone is going through these kinds of things. How we deal with those is obviously unique to those organizations and so forth. Obviously, there's some much bigger hospitals than ours that have a whole lot more layers between staff and administration. I think that's one of the things that I enjoy. It's one reason why I came back. I was at a 2,000 bed facility before. I came back to a small hospital for a reason. I started in a 100 bed hospital and we're finishing a 100 bed hospital. Because again, it's more personal. You get to know the staff, you get to know issues, speak with patients and residents, and so forth. But I think that provides a whole much a better level of care. I mean, just because of you get to know people and they get to be a part of it. It's a family. And as like I said, it's not to say that all families get along like everything at all times. But the point is, at the end of the day, they all love each other. And I think that's true here as well. So, like I said, this is all, I've absorbed everything that's been said today. And like I said, as has my administrative staff, I thank them for spent about 7 hours in drafting that response. And so forth. I'm sure we have a lot more hours to go and coming up with solutions to all those. And those solutions, we will be calling staff in to talk to them about it. And this is one of the things, like I said, where we ultimately got to need to hear specifically from certain people who give us more information than was presented in the questionnaires, just so we can get to meet us and those things. So, and if we have to go through somebody else, that's fine. I understand the anonymity part, but the bottom line is we all want to hear this stuff and we all want to make it better. So that's my perspective.
Thank you.
Jean, did you have?
One
other comment.
There was a comment in that document about misogyny and females feeling mistreated. If that's occurring, whoever is feeling that needs to report that to Cassandra, and we need to get on that. That's something that I don't think is right, not tolerable at all. And if there's evidence of that, we need to fix it right now.
Okay, Jean.
Okay, your first name, I know it's Mrs. Brown. What's your first?
Kelly Joy.
Oh, Kelly Joy.
Yeah.
You have done an awesome thing. You gotta carry a big stick and walk softly a lot of times. Once in a while, you gotta swat somebody with a big stick, and I think you did awesome. I can't say anything that's negative. And I'd like to comment on Tiffany's. Tiffany, I've been in this hospital a lot, and I haven't had a bad meal. I love the food. I know that's a terrible thing. However, in communication, different people think in different. If you went to visit one patient a day, over a period of a month, you would have visited almost every patient in here. Because SNF is primarily the patients. Maybe it would be good to stay in tune and get their head in your head. You know what you're doing and you know how to cook and you know how to serve the food and preserve it and do everything you do. But what were you saying about the ceiling and the floor?
Baseboards, between. And
Maybe
Tiffany, I know that she has visited, the employee.
Can I just interject?
Oh, yes,
So I go to resident council once a month.
that's
and
where I was
this
going.
Last month, the residents had outstanding comments, like Laura, the activities director, and her report. She was like, this was one of the best overall meetings that they have had. The residents love the food. Again, people have preferences. Maybe someone doesn't like the tacos, and it's not because they don't like the tacos. They don't like spicy food, but everyone else loves the spicy food. But I talk to them daily, monthly, quarterly. I visit everyone.
I've never heard anything but positive about it, but at that meeting, were you carrying a big stick? And everybody was agreeing with.
Cast iron skillet. But residents at resident council, if there's a problem, they are not afraid to share it. So, and those minutes go to all the managers and stuff. You get all, yeah, and then different managers have been invited. They do go if they, I think Tiffany, you
I
usually
go
go,
every
yeah. But it's on the request of residents because it's their right to invite who. We can't just say, can some, we could ask them if they want someone to come in and speak to them from a department. But unless they say yes or request it, we can't do it. It's their meeting.
And in those, there are things for dietary, there's things for maintenance, all the departments are brought up. And comments from the residents are put out and we always respond to them.
Right. So if anybody else have anything, I'm just, oh,
Yes, I got a question. I'll make my comment now. I mean, so it's great, but Sam, regarding the ER, are we gonna get analyzed because we're critical access hospital for closing there?
No, when I was in touch with EMS, I was in touch with CDPH. They understood, no issues there. I kept them apprised throughout the night and in the morning. Even the next night, let them know staff had been on, we had full staff and everything else. Like I said, that they certainly understand these issues happen, especially in rural hospitals where you've got limited staff.
CDPH has already been here. They looked at our after action report and they seem very satisfied with our response. We did have a physician here. We did have a ER tech here and we had a nurse that was at home that was willing to come back on call.
She was on call too.
So should there have been somebody that didn't get the message that showed up, we would have been able to handle that situation.
and
And
there's,
CDPH was told that they do that, so they felt comfortable that, okay, again, if someone walked up to the door that hadn't heard or hadn't seen Facebook or whatever, then we could have dealt with that. That was all discussed with the physician before we left that afternoon. And so we had it covered every which way that we could. It's the first time in 45 years that I had a department like that. And so that was a very hurtful thing, especially obviously because of our community obligation. We're here with this community to owns this hospital. It was built by them and it's here to serve them. And so, like I said, yeah, we don't take that responsibility lightly. It's, so that was a hard thing to do. But, we tried everything. I even reached out to Bridge Investment. I find out if they had nurses and stuff like that. So
we did have a psych nurse that was willing to come in. She isn't IV certified, but she's working on that now. She's worked here before. Her concern was the Pyxis, she's willing to get orientation, but there was a psych nurse that was showered and dressed and ready to come in.
There were also 3 nurses down the hall on med surg.
Right, that could have done the IVs or done whatever, yeah, so.
but the idea was an addition, was trying to, people with it, well, if there's, you need enhance, they'd be here to help, that was very much appreciated.
Yeah.
Just so you're aware that, the Policy and Personnel Committee met Monday after that weekend. And we talked about this in depth. And I'm confident in the solutions that Mark and Tim have come up with, so it never happens again. And, they're under their own authority, they will act, make sure that happens.
I want to just comment that I made a nurse float pool draft. It's on my nursing staffing plan that I've shown Tim. I just made that today. It's incentivized nurses to be available prior to a shift. If there's a call off for that shift, they'll be committed to filling in on that shift, but they'll get incentive pay for 3 hours before that shift. So, and that'll be pretty generous. So if you are part of that float pool, you'd be available before a shift for that 3-hour window of sick call time. If somebody calls off, then you're committed to fill in on that shift. This is just some brainstorm idea that I had because I don't think I could cover 12 hours like that with a 4th nurse on call. But I think if there's a sick call that comes in, our sick call window is 3 hours before the shift. And if somebody's available for that time, once they don't get a call by 7 PM, they're off the clock and they're let go, but they get paid $75 to be available.
So back to your statement real quick. I had talked to,
Mayor.
yeah, you, no, I'm looking at,
Kelly.
looking at you.
Okay.
It's you. I think, any of these concerns as they come up should go to board policy and personnel. Because it does have the exec team. It does, the board gets, there's 2 board members on it. The board does get all the, we get the reports and stuff. But yet, HR is there. I think it would be something that would help keep everything rolling. And they have a place that you know that there's a group always, besides the exec team and stuff, always following up on it, just to keep us abreast.
And all those board meetings are open.
Oh, they're always open.
Yeah.
Anybody from the community.
Anybody can attend.
No, I know.
Yeah.
Catherine and I had a little talk about that. I'm like, just have them come to the board meetings or to any of the meetings. So, yeah. Okay, any other questions before we?
Just one thing.
Okay.
I just want to make a statement. Thank you for the data. Keep those types of things coming to us and to management because we need to know those things. I just wish that more of the family of KVHD would attend these meetings because they would find out that a number of these items we've been addressing the last few months. And if they.
And they're recording online, they're recording online for that.
Right, yes, but it's just, if they would know that we were working on them, they might go a little differently in the way that things would be interpreted.
Is it possible for administration to maybe send out a generalized email reminding employees of that? Because I was not aware of that until this all happened.
What?
That these were public meetings. I always thought that they were just private.
Absolutely.
I mean, I understand. Yeah, I didn't know that. And I'm thinking if I didn't know that, maybe even just one other person may not know that. And
Maybe a reminder.
maybe just a general reminder through an email might be good.
Thank you. That's all. Thank you.
I'd like to mention one good thing about that check.
Yeah.
It's still car insurance. Everybody was driving so much more careful.
Okay. We're gonna stop this one and we're going to move on. Hopefully, we've answered your questions. You're more than welcome to stay for the rest of the meeting.
Yep.
But if no one else has any comments on that one, we're going to move on. Okay? All right, thank you. It's your turn. You.
Yeah, Carrie. Right.
And Carrie.
Oh, I thought you were looking at me.
Well, I thought you were
You
looking.
guys don't want to hear my report. Good afternoon, everyone. You get a verbal report. I was on vacation last week and.
Yes, you
didn't
were.
get Heidi.
Unacceptable.
I'd
No,
like to apologize on behalf.
he answered my text while he was on vacation. That was good.
Yeah, I mean, I knew I was on vacation, but there was some key stuff that I'll discuss that I was very finished. Being my first topic. So back in, I think it was April of last year now, we applied, came from the White House for Microsoft's nonprofit pricing for rural hospitals. It's called Microsoft Cybersecurity Program for Rural Hospitals. So I applied for that and it was basically crickets. I kept trying to reach out like, hey, I did this, like what happens now? But just maybe last month, an organization reached out to me offering their assistance for this. They were trying to sell me something, but nevertheless, they gave me the information I needed, which was for us to qualify for this program and receive its benefits. We actually had to go through their nonprofit portal, Microsoft's nonprofit portal, and request basically nonprofit pricing. So we're not a 501c3, but nevertheless, the same avenue needed to be taken to apply for this particular thing. We were approved for that. This means, starting now, that all of our Microsoft purchased services will receive roughly a 75% discount. Wow. So currently, we pay about $12 per user per month just for Teams, email, all these cloud services is just what it is. So it's roughly about close to $4,000 per month. And so that will be reduced by 75%. We have a year obligation under that pricing. Thankfully, that obligation ends in end of
Can we
February.
make it 10 years?
Well, no, I'm saying our current obligation for our current rate ends in February.
Oh, okay.
So at that point, I've already canceled the auto renewal, so we'll be able to switch license.
Okay.
Can I use the savings in my department?
I think it needs to go
I got
to-
him in construction.
I'm gonna need it.
So the discounts are 75%, so we'll be reevaluating kind of what we do there. So Microsoft has a number of different services that we kind of have with other vendors, and so I'll be reevaluating, is it better to move that service to Microsoft or to keep their current vendor based on cost and lots of other different things.
And, will that be an auto renewal or do you have to reapply every year?
So it looks like, and again, I'm kind of new to this, but it looks like, so we use a vendor called Insight to make all of these purchases. It looks like I need to show proof of our nonprofit status roughly every year and a half. Just me forwarding this document proof. So as long as nothing changes with what's offered, I think we're good.
Okay.
These discounts also include like server licenses. I don't know who was on the board at the time, but when I started running IS, there was a deficit for licensing that we needed to correct to be in compliance. Had this program been in place at the time, we would have paid 75% less for that. But that,
Retro,
no,
we paid a lot of money.
we did pay a lot of money for it, but those licensing costs renew. So server licenses reach end of life, and so now when we get the new ones, that is going to be applied. There's other stuff that I'm still figuring out, but that's kind of just what's.
That's great.
Yeah.
Can you call FEMA?
Yeah.
Yeah. Wish I could. FEMA's a little bit, there was a little button that would work for FEMA.
You don't have it?
No,
We'll find it, we'll find it.
haven't found it
Good
yet.
job.
Yeah, FEMA's a little busy right
Moving forward, a local organization has gifted the hospital with 3 color copiers. Typically, these things run, 3 is $5,000 a piece, so they gifted us those. We worked with our vendor to get a quote to allow those to be under their support contract. We don't handle any copiers here. So we got that all taken care of. It's going to be about $3,000 to get them to a level where we can put them on our support. Trying to figure out exactly what we're going to do. There's really a need for maybe one of them right now, but I don't know when. Soon Bob's going to grab them at some
They
point.
haven't given me a
now. So
date.
this was
I'm
the
not saying
same
about-
connection that we got all those cubicles.
Ah,
Yeah,
okay.
Damn process.
so these are not heavily used copiers and they're not that old.
All
They
right.
actually are pretty old. They're 12 years old, believe it or not. But the use is very minimal. So-
You know, once you connect them up and people start using them, they're gonna be indispensable.
They're all color, so.
Yeah, they all are colored. So we'll probably just do one right now, probably the one that needs the least amount of maintenance, and then just kind of hold on to the other ones for as long as we can. There's no sense in paying for maintenance on something we. The IVR,
The colored one?
oh, she's the one I'm referring to.
Just want to make.
There might be other needs elsewhere. but I figured it out.
Hers is a whole lot older than 13 years.
Just want to make sure she's getting what she deserves.
He's the one.
Okay.
The IVR at Mesa Pharmacy, I know we discussed previously where it's an automated system that's handling a lot of their refills.
What's IVR mean?
Interactive voice recorder.
Oh.
So that system's been in place for a month and a half, 2 months now. I talked to Suda to get some kind of feedback on how that's going. It's roughly fulfilling automated 40 prescriptions per day, so that's saving them quite a bit of time. Phone calls. So they're not even on the phone.
Yeah.
It just does it. So that's great.
You know, what do you know? Okay. Because of our non-preferred status last year, I went to CVS, right?
Okay.
And I saved them probably $30,000-$40,000, probably close to 40. My first of this year, I switched back over here.
Okay.
Okay. And my first copay was $800 on one medication. And I asked the girl, is it in? And she says, oh yeah, it's been in for 2 days. CVS would call you when they got it in. Then when the doctor sent it to them, they would either email you or call you.
Okay.
And our pharmacy said, oh no, you don't have to call to find anything out.
So this IVR does allow you to check. There is automation in some avenues of,
Well, how much trouble would be when it comes in? It's a lot of money. Let's send an email.
there is stuff like that in place. So I know that there's an app that will send you notifications. If you go down there and talk to Sue, she'll be able to point you in the right directions so that you can get this.
I get notified when my script's ready down there.
So I get a text.
So there's a way to do
It's
it.
a text message.
So the girl
You have to
told me
sign
there
up
wasn't a way.
You have to sign up.
I just.
I'm not sure.
It could have been
Yeah.
somebody who just didn't know it, but it
Okay.
existed. But if you go down there, I think there might even be like a little QR code that they have for promotional material you can scan and you can get it all set up.
Okay.
there. If not, I'm sure Sue or somebody down there would be. able to
Couldn't
help
figure
you.
out why we wouldn't do that.
Yeah.
$20 a month, I'll call you.
Or take one of your radiations.
Yeah.
Grand, I'll bring you.
Yeah.
You wouldn't think I'd be worth that much in a year, geez.
I'll bring it down the street.
Yeah, now, were you answering a question I had about communication with the board online? Whenever you were talking with Michael?
Oh. I wasn't specifically,
Okay, can I ask you a question?
yeah.
Okay. The last 3 meetings that. What's your Fred?
Right.
And John and myself have been unable to have visual, which we've all had to call on the phone.
Okay.
It's very difficult to do that because John says, I can't see. He's even said it while he was talking. You want eyes to be able to see it. What's wrong? Why board members can't get online, get in here? Why can't we call in?
That's a great question. I don't know.
Well, you're the person that does
Let
it.
me finish.
Oh,
Operator error.
I mean, I'm not saying it, but there are, to diagnose right now what your or anybody's particular issue was, I would have no idea. There's, the service itself works. Teams has roughly 40 million active users
James does.
that use this application. So for anybody's individual problem, I mean, I'm happy to do my best over the phone, but it's not always.
Does Teams come automatically with the
You can
phone?
talk to that.
I will say without a shadow of a doubt, that was
I remember that.
Teams come with the phone? If I get an iPhone, does it come with it?
No, you have to install the application on the phone.
Okay, did you tell us that?
I did not.
Why?
I don't have an answer for it. I
You
mean,
changed it from, you got rid of Zoom,
mhm.
you got rid of everything else. And we're out here in the cold.
There's a
Teams
link.
is part of Microsoft, correct?
As part of the Microsoft suite, kind of what I was addressing before. So when Heidi sends out these email notifications, yes, there is an app for Teams, but inside of that notification, there's a URL that you should be able to click on and join the meeting. Just how everybody here
Can-
can join the meeting.
Can you guys maybe set up a meeting
I
offline
love that.
Yeah.
and have somebody go out to Teams?
It's on your computer.
Yeah, bring your stuff in. I'll sit with you. We'll get it all going.
Meet him at the pharmacy while he's getting that figured.
You wanted some one-on-one time, right?
No, I wanted to know why we couldn't and we couldn't be able to communicate on our,
The list of possibilities, I don't know.
I mean, I'll give you a great example. We had finance committee the other day, and John's been on Teams for a long time, obviously, well. And never had an issue, and boom. People saw, those that attended the meeting saw what happened there.
Hey, Scotty, you having any problems seeing or hearing us?
I have no problems at all. You're loud
Good.
and clear. Sometimes the feed goes in and out, but 99% of the time you're just fine.
Perfect.
do you have Microsoft Teams on your phone or your computer?
I have the app on my computer and my phone.
Where'd you get it from?
It's part of the Office suite.
Microsoft.
So I have a subscription to Office 365 and Teams is one of the programs that comes with it.
Okay, let's move. Do you have anything else, Karen?
I do.
Okay,
That's all right.
that is okay.
I'll go quick.
Perfect.
SB Services, this is a company that we hired to handle our USAC grant. The acronym we're looking right now, but it's a USAC grant basically for telecommunications for rural hospitals. So I'm happy to say that starting in February, now that that's all been gone through all the public channels, we will start to see discounts on that. The total discounts, and this is for our MediaCom and GeoLinks bills, both for internet. for the facility. Those discounts will be roughly not roughly, exactly $16,379 per quarter. So it's about 65 grand per year that we're going to get back from using that service.
No, that was to, it's a-
And then lastly, just for transparency, in 2025, we will need a server refresh for all of our servers that handle basically the hospital operation. The support is end of life in 2025, and furthermore, VMware, which is our hypervisor, so that is the virtualization software that does all things, will no longer be compatible with the servers that we have. So we will need a server refresh, which I don't know exact quotes, but I promise it will be expensive.
You'll have a capital budget.
Yeah, that's actually written here too. That's all I got.
all right, thank you. Any questions, comments? Okay. Get this.
I do not,
Here,
I have
adjourn it?
information.
Okay,
That isn't passed this time for her report. Her husband has received a long awaited needed procedure.
Yep.
And so she will be out for a little bit of time. She's working remotely. But they need to be isolated while all this takes place. But it's all going very well. Okay.
okay. No old business, so we're going to move on to new business. And these items are going to need, some of them are going to need action. The Greenbow design, the medical air compressor replacement, Bob?
Okay, so, for our surgery department for medical air, we have a dual compressor upstairs, been in there for 30 years. And the other day, one of the compressors broke. No longer will run. I had it evaluated by our company that does all the repairs to our medical gases. And they recommended that there is a replacement available. The company that made the compressor system is no longer in business, but there's another company that makes a compressor that replaces it. The challenge is that, so what I did is I ordered the compressor and it is here sitting next to the machine. But I reached out to Oshpod because I figured I could replace this under what's called a freer manual, which is a field review process. So I filled out the forms and I shot it off to my area compliance officer. And he checked with his boss and they said, nope, you cannot do this as a freer because you are breaching a medical gas system that is breathed by the patients. So therefore, you must submit plans to replace this compressor to Sacramento. And so how difficult this is it's 2 couplings, 2 belts, and 4 bolts. But I have to submit plans. And so this proposal from Greenbow is for the, mainly it's 90% of the cost is for the mechanical engineer to draw up a couple sheets that says this is what we're doing. I have to submit it to Sacramento to get their blessing before I can then have my mid-gas company come out and they will install it because it's medical gases. I can't just do it and whatever. And then once we have put it in, we have to go around and certify every outlet that serves that we have not got any particulate in the system and that the air is clean and it's all working properly. So there will be some testing that will follow the installation. This is just a proposal to draw the plans so that I can install the compressor that I already have.
Do we need a motion for that?
Yes.
Okay, motion. What he says.
I'll second.
I tried to get it in for free. It didn't work.
Yeah, it's a big price tag for such a little thing, but
It's so frustrating.
yeah.
All in favor?
Aye.
Thank you very much. Ross, I think this one's you, right? Building and Planning Committee discussion?
Yeah, I have brought up,
I'm sorry, I did have a question. Under that one for Greenbow Design, it says recommendation, consider increasing shift overlap. Is that a typo? Okay, just wanted to make sure.
Is it supposed to
But,
be?
but that is something I'm working on.
Isn't that what we approved?
Yeah.
And I'm already working on it, but I just thought if I.
And now we've approved it. So
Okay,
you're
cool.
ready to go.
All right.
The last couple of building planning committee meetings, it's always good to meet with everybody and say hi and conduct business, but they seemed unnecessary. So my thought here was, and we talked about this before, there were a couple of iterations. One was have the committee meet as a committee like any of the others, just a couple of board members and the involved staff. Or just kind of sunset this for a while until start to have building activity again. And so, we've got this as a discussion, and I guess it's on the agenda so that we can decide what we want to do with it.
Yeah, that's what I would think. So, I think we have discussed, that there wasn't a need for, monthly at this time. So, and if there was, and the board thought that, meeting once a month would be fine with just, as a normal committee where 2 board members are on there. Or go to quarterly or go to as needed. As needed kind of concerns me because I may feel the need and someone else may not. So, discussion, what would you guys like to see done?
We can still do it at the board meeting.
We can do it. We can cover it at the
Nothing that
board
can't be
meeting. or-
done at the board meeting. And I agree. Can I give you my opinion on why I'm getting rid of it?
Yeah,
Okay,
kind of.
there is no way FEMA reapplied in September of 21 for that grant. September 22 is supposed to be drop dead date that they give us the money. They don't give you money later. We haven't gotten anything saying they're remotely interested. We've got a little bit of money in the bank that we've gotten from different PPP and different programs through COVID. It seems like the goal is, and I think all the board members are aware of it, is to string it along until all of a sudden, well, we can't do it. The only way we can do it is go to the community and have them pay for it. The last time it was $100 a year.
Can I interrupt you for a sec? You're talking about number 3 on the agenda. We're talking about the
No,
building.
you gotta
planning.
talk about why they're getting rid of it, why you wanna get rid of it. Okay, so that then you'll come up and say, oh, we did everything we can. You're not doing everything. You can run a hospital at a profit and you can do it the way it's supposed to be done. 3 years ago in September of 22, most people told us to get a program manager. Because
I'm Jerry.
the grand jury said, hey, get somebody that knows what they're doing, you gotta pay for them. They would have told us we couldn't go this far. And so the next step is just going to the community and saying, hey, it was $100 a month for our year for 40 years. There are a lot of people out there that $100 a year, it's a lot of money to them. And Tim, I know it's not a lot of money to you, but however, for our people out there.
It's money to everybody.
And so, it's just one step toward hitting that place where we say, we did all we can. We're not doing all we can.
Okay, let me ask you a question. Because we are gonna talk about the construction backup plan next, that's on the agenda. So, but do you feel that we no longer need the building and planning? I mean, I know you said why, you're discussing why we don't, but, and I think we're still in plan review, right?
No, plan review.
I mean, in review,
Permit
right.
still in
We're
review
still in-
with FEMA.
Still in review for FEMA, so they haven't given us
Okay,
a no.
have you got anything in writing saying we're the review?
The email of, you go on and.
Well, yeah, a while back, I reached out to the consultant and they said, yes, you're still on the list of who's being reviewed. The reality is, so everybody understands, if this would have been approved in the normal timeframes, it would have been approved a year ago, August. Why FEMA is all, whether they blame it on COVID, whether they blame it on whatever, but FEMA has drug out the approval process. Nobody has received funds from the 2022 BRIC funding.
There are still hospitals that are projects that have not been funded from the 2021
Yes.
thing as well, so.
And so,
That really.
and so I don't know if there's an issue with the funding on the FEMA side
That's
of
what they
things.
say on the news.
I know, but I'm trying to not just believe everything I hear on the news. But I'm just saying is we're still in the process of approval. But I don't think anybody's gonna get approved until FEMA, gets funded a little better, I think.
I just have my opinion on this. I think the monthly report that we get from Bob is great, but if we can handle it at the board meeting, it'll be a lot.
And I'm fine
Until
with
we
that.
need to meet formally.
And we decide when the.
Well, if we get approved for FEMA and we start rolling into this, then maybe we would want
It's a
to have
different
all.
There'll be a lot more.
Yes,
Okay,
I'm in agreement with that.
okay.
I was thinking,
John?
I agree with that too, because depending on how much work is involved, I mean, you might just have one specific meeting that's just for.
Well, and currently, the work, whether I report here at the board meeting or at the building and planning,
Goes
it's
to both.
taking on a work meeting. Yeah.
Right,
It doesn't change what I have to do to be ready.
okay. So does this have to go on to the next meeting for action? So we can just
So,
take action on it right now?
let me let me just say that under the Brown Act, you don't have to have building and planning was a special board meeting because all 5 of you were there. If you do not post at a meeting, if you do not post an agenda, then you don't have the meeting. So you don't have to do anything if all of you are in agreement that you're just going to roll it into the regular board meeting.
All right,
Thank you.
thank you. So glad you were here. Okay.
Do we have to pay you for that piece of information?
Absolutely.
And everybody's in agreement, aye?
Yeah, absolutely.
Well, those are good both, because this is a discussion.
Well, I know, but I just want to make sure you said if,
Yeah.
Scott said if everybody was in agreement, I
Well, I'm making a motion.
So we just need to pass it on agreement.
Right,
No, we're not putting it on, we're gonna have it every monthly meeting. We'll have an update.
at the board meeting.
No, that's board meeting. I thought you
That would be
could
good.
get rid of the other one. Somebody went, did you want to vote?
No,
Okay.
you don't want to vote, right? I have a stick. Big one. That's true. Okay, so now we're gonna go to the construction backup plan if FEMA funding fails. And Jean, that was what you wanted to talk about. And so you're, part of your,
Put part of it into what, like Ross was saying. Instead of what I was talking about. There's no way that we can do it even with that FEMA money. If we had hired somebody like the grand jury said to guide us, that knows what they're doing, we wouldn't be in the position we're in now.
I'm not sure I follow. Bottom line, if we had hired them back then, we could pay a lot of money. Not that at this point in time, there's nothing to do
Okay,
until you get the money.
they could have told us to look in a different direction. We could,
They wouldn't have done that. That's not what they do. Different financial people might have been able to guide you, but not a construction manager. To put you that advice. So I think the issue, like I said, is from my perspective, is the bottom line is, I still believe FEMA's gonna come through. I think what we need to do is we need to maybe now, if we've been kind of laying back, not even wanting to disrupt them.
dragging it on.
No, I'm not suggesting that. What I'm suggesting is that we get Vince Vaughn involved, and have him go through and start making inquiries on our part with regards to the.
I like that plan, and it needs to happen now before the 20th,
Right.
because all the money's probably gonna be gone.
You,
oh, he just sent me a text too, asking me questions, so I'll put that as my answer.
eventually,
Yes, did you guys get one?
Get FEMA to act, no,
Really?
Donald.
No, from Vince Vaughn.
We block spam.
And,
You know what? He even said
the
thank
last
you.
meeting, yeah,
What's that?
the last meeting, I think it was, at the voting bank. We agreed to get John to look into the fact, what could we do with that money if we had it, could we borrow more money? What can we do? What do we do?
We have a meeting.
How is that coming along,
I'll
John?
share with you. I reached out to Gary Hicks, and Gary's coming to visit us the next couple of weeks to talk about that and so forth. With the holidays, he's been out of town and stuff like this, but he'll get in there. But he's very much interested in doing that. So he'll be meeting with John and I to sit down and take a look at what options are there. If we need additional cash or whatever, what can we do with the current money, and so forth. Bob and I have certainly talked a number of different options. Let's say FEMA doesn't come through. The bottom line is we have enough money set aside at this point to begin doing a number of those different phases that were identified. And so clearly we could do that, put up shear walls, those kinds of things that will add rigidity to the building. As a step towards meeting seismic compliance, and certainly, preventing, potential collapse of the building, those kinds of things. We would probably run out of money by when we got to the phase of building.
Well, actually, how much money we got? Just this thing.
Josh.
We got money.
We have like 10 million.
What's gonna happen is our IGT money can increase in the years to come too.
How much money do we have there
Got 20 million bucks.
that we can use that we won't miss?
Oh, no, we're missing. We're
Construction.
missing. We got $20 million in the bank right now. You said we weren't operating at a profit. We are operating at a profit. We'll continue to operate at a profit, I hope. So we're
Well,
not
if we
using that money.
do, what we need to for the employees, we won't be operating in a profit.
How can you say that?
Because they're underpaid. They need paid. Scott,
Okay, that's a side issue.
Scott, well, it's part of.
Okay, so to answer your question, to answer the question out on the table, how far could we get with the monies we have now in the 9 phases of the plans as they have been approved by Oshkosh? Probably through the end of phase 6 of the 9 phases. Okay, that being said, those total approximately 10, 15, about between 17 and 20 million. Okay, to get to there. That doesn't get us the new ER. ER is phase 7, CAT scan is phase 8, and final acute care is phase 9.
Can we stop somewhere?
We can stop after any one of those phases because they're designed that way.
Okay, but what about our compliance with the earthquake?
Well, again, unless all 9 phases are done, we're not fully compliant.
Scott, are you there?
I'm here.
In Senate Bill 1953 plainly says, and I know you guys heard me say this before, it applies to hospitals built after 1973. We were built in 68. Now, we've got Tim's interpretation, we've got Bob's interpretation. Can we get an interpretation from whoever enforces that Senate bill to tell us that we must comply? I haven't seen anything saying we must comply.
So SB 1953 applies to all hospitals in the state of
It was built
California.
af- It says right in the first page that was built after 1973.
So the hospitals built after the Silmar earthquake typically meet the building codes that were in place and when 1953 was adopted. So it would not apply to those facilities. It would apply to the older facilities that do not meet the building code seismic requirements. So if you are a pre-Silmar hospital, then it will apply to you.
It says this applies to hospitals built after 1973.
One of the things it did require was a review of all hospitals in the state. And a seismic assessment of whether or not they would withstand her.
It's Senate bill that what we're referring to, we're not in compliance with. right on the front page, it says, this applies to all hospitals built after 1953 or 1973.
But it goes on to explain that those built from 73 on
In the same
are,
bill,
are more compliant.
in the same bill,
Yes,
without,
I believe I forwarded that bill to you.
well, you informed it some changes and everything, but if it didn't apply to us to start with, the changes.
I Gene, I would love for you to be right.
Okay, well, Scott, can you look into that?
Yeah, I'm happy to. I'm happy to look into it, but yes, it will apply to you. And it has always applied to you. There's never been a time where it did not apply to you.
Even though right in the front page, the very first statement is, this applies to hospitals built after 73.
And yes, that statement is right on the first page. I completely agree with
You
you,
gotta read the fine print.
but you gotta keep reading.
Yeah.
I read the whole thing, and what you're saying, I didn't see it. I
Okay.
must have been missing a page.
Okay, so
Okay, so what do we, my question is, what do? We don't FEMA, especially with the money that they're gonna have to shell out on this. FEMA's not likely to look at that favorably. And we're gonna have our backs against the wall before they might consider it 5 years from now. They're gonna keep it open for 5 years.
I don't know. I mean, again,
We're still hearing
I
the
will,
prior years still, but
Gene, I will reach out to the consultants that are working with FEMA again and ask them if there's, is there any give on the 2022 brick? Do they have any estimate of when it might get approved? I'll reach out to them.
But we're just going along. Now we're getting rid of the planning to where nothing will be happening and we'll quietly go along until our backs are against the wall. And you're gonna say, oh, community,
I
pay
mean,
for
we're not
it.
getting rid of that. We're just moving it to the regular
Okay.
board meeting. We're not getting rid of that because it's just, there's nothing happening at this moment. But we're still gonna get updated. People give us updates as that goes. So we're not really getting rid of it. We're just.
What I'm saying is we need to work on the alternatives. We need to work on the skilled nursing. The census, it's 40.
Right, and that's something,
65.
That's what they said.
I know.
We-
We're working.
well, no, I haven't, but, I'd like to, but yeah, that is one of the, but that doesn't have anything to do with the construction. We do need to get the census stuff. That is a different thing. And if we do put any shovels in the ground, then we are not able to get to FEMA. So that's why we're at a standstill right now, even though we do have other options.
I
Okay,
think the
so
idea is to go ahead and let's try to apply some legislative assistance and see if we can get a response from them. Yes, they are planning to do this, it's being tied up for these reasons or whatever, the patient, or whatever. Before we make some decision to do something else, like I said, I mean, we've done that because we didn't want to upset the apple cart and say, well, heck with them, they're making issues and start pulling that legislators on it. I think we're at a point, like I said, we've waited long enough that.
but we need to do something. We can't, we're going backwards.
Well, I think in
We're not
the
going backwards.
next
We're
6
standing
months,
still, standing still.
copper's gonna go down. That'd be a plus, right?
Yeah, that's it too.
Cheaper copper.
So anyway, the bottom line is, let me reach out to them and we will.
So you're gonna get what I'm gonna say, if we could, even if we got that money,
Yeah.
it's not enough.
But then we have 20 million in the bank to make up the difference.
And we're
And it's
going to get ready to get money, the ICT money's coming in. And as John was saying, they're anticipated that they're going to be growing in volume. The amounts of those.
It's gonna double, it's gonna, but now we're getting from ITC. it's gonna
That's
double
sort
to
of indirectly tied to FEMA too, right?
Okay.
No,
No,
That's nothing to do with you.
it's still government money.
Gene, can we move on to the next one?
Okay, let's see.
Yes.
Yes. Okay. Oh. Can we do number 5 before we do 4? Is that all right with you guys?
I don't have an issue with that. Yeah, I either. That's fine with me.
Okay, so,
I wanted to
Ross?
discuss the pharmacy expansion. We talked about it. John, you were gonna do a pro forma.
to see what the payback period is and you know, the pharmacy potentially can make us a lot of money through this. Is it 340B? Is that the right term?
Yes.
You know, when we get the right staff in place and that starts generating the revenue from that program, it's gonna pay for it in a
Yes, it
short
will.
period of time.
We're trying to quantify what the money's gonna get us every year.
Okay.
And we are in the process of figuring that out right now. We've come to figuring out how exactly to build this now, where we didn't know that before. And it's not gonna be through increased revenue, it's gonna be through reduced expenses.
Yeah.
So if the FEMA money, I'm not the FEMA, but the 340B money comes through, it's gonna be about $500,000 or $600,000 a year. And if we figure that it's gonna cost us $1 million to do the
For a couple of
2 years.
Yeah.
Then it becomes a doable project.
Soon as I can quantify, we're in the process of doing that right now, I'll give you a pro forma. But we still need to quantify how much it's gonna cost us to do it too.
Yeah. I know. We were kind of
using round figures.
We were ballparking.
Yeah.
Right, and so my ballpark figure is 2 years.
Okay. The unanticipated revenue we got from Current Health Systems recently, can we earmark $1 million of that for pharmacy expansion? Would that be a prudent thing to do?
That's not, and it wasn't unanticipated, that was our AGT money.
Yeah. We didn't.
Oh,
You're right there.
Did we get $1 million more than we anticipated? Was it?
A little bit more, yeah. And that's only half of our IGT money.
Let's build the pharmacy then. Why don't, is that a shoot myself in the foot thing to do? But
Well, like I said, Bob and I needed to sit with Suda and figure out a floor plan that'll work. And then we can estimate the costs from there. And then we can figure out how much money we need. And so, obviously, like I said, yeah, we can do it public today if we wanted to, but obviously we can shorten the other projects. So we didn't want to do that, like I said, until we get all these answers. So.
And John, you're talking to somebody about the billing? Is that what's going on?
We're doing it internally.
Yeah.
We know how to do it now. We have not done it correctly before, but we figure out how to do it now.
Okay.
And that's it. We were able to go back a year. The year that we missed right now, we're able to go back a year and get that money too.
Okay. So we've got the need right now for the pharmacy. Have you been in there? Have you waited in line for prescriptions? They're busy. They're very busy, and I don't know if it's prudent to wait on the seismic project.
Well, I'm not suggesting that.
Ignore the.
No, I'm not suggesting that at all.
Okay.
I'm just saying, depending where we choose to pull the money from.
Well, and here's what I probably need to do. I need to reach out to the modular company that we've got numbers from that specializes in pharmacy and medical buildings and find out if they have an architect who is good at designing the spaces or can recommend somebody, because not just any architect can draw up the floor plan. And if it's a modular building, usually they have somebody on staff that designs the interiors of these spaces. They would have to meet with us and meet with Suda and get her needs. And then they could put together, do we need 3 modules? Do we need 4 modules? The next step to me would be, we need someone who can properly design this.
Is that something that our folks,
Greenbow? No, I doubt. I mean, I have no problem reaching out to him, but he's gonna say, no, I don't do retail pharmacies, I do hospitals.
And then he's gonna charge you $2,000 for the restaurant.
then how do we get this firm? Do we have to do an RFP and?
Well, the answer to that would be yes.
Okay, can we move forward with that?
Who did the one that couldn't, Mike?
Oh, I do.
You're gonna check into that.
A retail pharmacy at KMC.
They have
Yeah,
one building,
yeah.
yeah. Next to the clerk's office.
I'll make it, I reach out to Scott.
Yeah, I have no contact.
It was probably the county that did it.
Probably would.
Yeah, they have their own design department.
Yeah, probably Mark.
Oh,
Forgot his last name.
Yeah, the architect we've used.
Yeah.
And that might be who who might be able to do it for us. I just am saying that I'll reach out to Greenbow, but I doubt that he's gonna say that that's his specialty.
I just want to see us move forward with this. It's something. The need is right now.
Yeah.
And the longer we wait and scratch our heads and go, gosh, how did we solve this? I think we're not being responsive It's the needs of the community,
You
so.
want to put that on the agenda for next month? For all the information?
Okay, yeah, we can do that.
Or just include it in Bob's report, that's fine with me, yeah.
Oh, okay, no problem.
Yeah, okay. No problem.
It's got a little bit more news.
Yes.
Just an idea. I mean, staggering some lunch breaks could help the situation. Have places to take a lunch break for 1 hour instead of multiple departments. That could, you have more hours than day, you have more room to fill.
It won't work, but they need space.
Let me explain, you can't do that. Because you have to have a pharmacist in there all the time. So, and may or may not, sometimes they only have one pharmacist in there, so you can't close it at that point, they all have to go when the pharmacist comes. So that's the problem. Like I say, right now, we're a little better off because Darren is there, so we've got two, but there's some days where he works on 5 rounds, so. We have to physically be in the pharmacy.
And then Saturdays being.
Yeah, we've talked about that, that's our.
Definitely.
I guess I'm making these points not to say we don't need space or anything like that, but that those might be
Could have helped in the meantime.
that certainly reduces some of the pain that, okay, now we have more, an hour extra per day or 8 hours extra that some of those people can come in.
And that's.
Salary would be huge for a lot of people.
It would be.
And there's staffing issues and stuff like that, but some of that might be worth, I'm just presenting an idea. I don't know if I'm right or wrong, but
It goes beyond the line of customers. It's their ability to do their work. Yeah, within that confined space, I don't think we've got enough.
It is time, it's not much.
We've almost doubled our number of prescriptions in the last 6 months.
So we need to bring back for discussion is maybe, different hours opening since we can't close.
I mean, that's what you guys want to throw an idea.
Yeah, well, it's worth discussion. I mean, Saturday
I would just think that, then you have that discussion with students.
Right. Well, the other thing too, like I said, is some of these tools that we put in, like the IV are.
Sure.
Those are things, like I said, that cut down, that allow the staff to be more efficient because they're filling things, which cuts down all the time. They have to stand in line and they're already waiting for you. There's a host of things that we're looking at in terms of possible solutions to manage that. Yes, we still need to add space. There's just.
Yeah.
So, but what can we do in the meantime to kind of get us through that?
Even if it's just, one of the ideas that Bob had pitched, one of those plans just had another modular building lighting up to the side of the existing one.
Yeah, I mean, that's probably the least expensive way of getting it.
It's the least expensive, probably it won't improve the appearance and it may not meet staff's needs for the space. So we'd have to get real creative with that.
Yeah, I don't see that as an excellent option. That was just like, okay, we are on a tight budget, it's not gonna be making much money, this could be an idea. But I don't think it's the best solution if this thing could pay for itself in 2 to 3 years.
And it needs a drive-through.
Agree.
Just
Yes,
has to have it.
yeah, because then we can beat out writing.
Well, and people in this long term, because these damn viruses that keep coming out, people don't want to make contact.
That's all I have.
All right, okay.
Drive-throughs.
All right. So, no, because it was a discussion that was pulled.
It's full then agenda.
Does it need to be approved?
Yeah, that's part of it.
Review report from,
So the report has to be approved.
no, there's no approval, it's just review.
It's just review,
But it's under
It says review
number
report.
14.
Actually, I agree.
Review the report.
Yeah, it wasn't an action.
We did.
Yeah,
It's
we
done.
did the action, but it. I'm getting it.
I want to vote on my one thing.
Bring that up the next time.
Okay.
Just write action item on it. Well,
All right.
we will.
By the way, congratulations on getting the switches for the generator. That's great news.
Yes. Oh, yeah, actually, that's the project's gonna be wrapping up. Quite short.
Good deal.
Okay,
Catherine,
yes,
may I jump back real briefly to Jean's question about SB 1953?
yes, did you look it up?
I did.
All right. I knew
So
you
in
would.
1988, in 1983, there was a law that was passed that established seismic standards for hospitals constructed on or after March 7, 1973. In 1994, the legislature passed SB 1953 and said, hey, the hospitals that were subject to the 1983 law did really well in the Northridge earthquake, and other hospitals didn't. So what we're going to do now is we're going to tell OSHPD at the time to go back and do these seismic standards for all hospitals. So the law that Gene was referencing that applied to hospitals constructed on or after 1973 was the law in place when 1953 was adopted, and SB 1953 expanded that law to include all hospitals.
What Senate bill expanded it?
SB 1953 expanded the original law to include all hospitals, not just those built after 1973.
When did they do that? In 88?
1994.
Okay, 94 after Northridge.
Yes.
Now, where do I find a copy of the expansion? Could you email me where you found that?
It's in the health and safety. So there are two places. In the California Health and Safety Code, the Alfred Alquist law is stated, and then the state has developed regulations. So there are the statutes and there are the regulations, and I'm happy to send you the citations. They're very extensive, but I am happy to send you the citations for that.
But you're confident that we are required to meet the seismic calculation?
There's no question that you're required
What
to
was
meet.
presented to us whenever we started the seismic stuff was the Senate Bill 1953. I guess it was, whatever the copy was, didn't have an 88 extension with it.
They just kept amending it to include more and more. It's still SB 1953.
So you were not subject to the original 1983 law, but you are subject to the 1994 law that was tacked on to the 1983 law. So you've always been subject to SB 1953.
Okay,
Okay.
all right,
Thank you.
thank you.
Thanks, Scott.
So now we're gonna go back to number 4, which is the election of officers.
You don't need me for that, right?
Yeah, you would.
Thanks for coming.
I'll excuse myself.
So as the board may recall, you can handle election of officers in one of two ways. You can do it by slate, where there's one motion that identifies all the officers, or you can do it by position: chair, vice chair, secretary, treasurer. It's entirely up to you how you do it. There's no legal requirement that you do it one way or the other. I believe historically, I don't really recall if you've done slate or individual office. I think it's varied, but those are the options that you can use for electing your officers for 2025.
So in the past, we selected the director, then they sort of figured out who they wanted to be in the different positions. And then at the next board meeting, we make these.
The chair only decides committee
Committees.
assignments. The board decides
correct.
positions. But the
Yes.
board chair decides committees.
Yep, that's absolutely correct. The board elects its own officers. The chair does appointments to committees unless the board overrides the chair.
Okay.
What? That's an option? Wait a minute. Okay,
I think that's stick now.
it's getting bigger because obviously I need it.
Are we ready to make recommendations?
Sure. What would you like?
You know, the one who seems to have the most time and has knowledge and is willing to spend the time is, I hate to even say this name, but it's Ross Elliott. But he was a good chairperson. And if he would be willing to do it again, that would be my recommendation for this year. John was excellent. He's busy. Maybe if John was second, I don't know, but John was very good, but I don't know about your time. What was that?
I was gonna throw my hat in the chair, but I don't care.
Okay, you would be good too. You get this guy. Has time, and he has the brains to use his time, and he has spent time for the hospital. And he's got different knowledges. Hell, he might even be smarter than me.
I have to disagree. Honestly, I was chair for 2 or 3 years. I don't remember how long. I think it was too long.
Couple of years.
And I honestly would like to see Catherine. I kind of would like to see the same board positions that we have right now, just repeat for another year. I would be good with that. I mean, that was very nice of you. Thank you.
You must be mad at me.
Well,
Hey, put this down on the calendar for
Right.
Gene and Russ.
A lot of it.
Yeah, they're seeming to agree quite a bit.
I mean, since I've been on, John has not been chair. Gene has not been chair.
But
I think it's good that we have a fresh person in the seat.
That shouldn't, but oh no, I don't have the time.
I understand. I'm just making the statement.
Yeah, I appreciate it, but.
Yeah.
Either, I think John was actually a very good one too, and Russ bumped him up.
Back to the old ways.
I don't know, for 2025 personally, I would just like, not that I have anything against you. I think you do a fantastic job.
Yep.
I just like to think that we should rotate it amongst ourselves and everyone hold the.
Okay, until next year, I'm gonna get better, until next year, can John, then if you don't wanna do it, could John take it? John, yeah, and you're willing to take it,
As chair,
yeah,
yeah. It's been 5 years since I was board chair, but yeah. And I'm a little bit more formal with the gavel and everything, but.
Obviously, you know.
And if you're, I mean.
No, I'm not okay with it. Yeah, I mean, well.
And it was a
okay.
landslide victory for you, John.
But honestly, I would like to continue for at least another year. I think I'm just getting it, you know, and I feel like, I don't need to explain myself, but I would like to do it again. And
change is good. And if I had time, I would love to do it.
you're really mad at
Thank
me,
you
aren't
guys.
you? So let me just get this clarified. I know we don't always agree, but you don't have to be mad at me to want to.
No.
I am on to
You
you.
have actually been a good,
That's what you keep saying until right now.
I have a question.
Yes.
How would you feel about being first chair? That way it's basically the two of you are on the show.
yeah, you started run together that way.
What did I do to you?
Nothing at all.
All
I
right.
just want to keep you in the chair of powers every time you talk and play.
Well, it's true. There's a reason for that. I won't explain that though, but
Can I then is it need to be in the form of a motion?
it does.
That would be
Yes.
John, then you second,
Yeah.
and I would like to be third again. I would like to be third chair.
It's second.
Again.
Yeah, but yeah, John, you have a first chair.
John first, second.
No, with John's
Oh,
chair.
first,
So you have first chair.
I want to be right behind you.
But that means she's second chair.
Oh,
So
no.
let me say this, you have a chair and then you have vice chairs. Or a president and vice president, whatever terminology you want to use. But you don't have co-presidents or co-chairs per se. You just have someone who fills in the absence of the president/chair.
But the chair and first vice are on the governance committee, which is a standing committee that we have to be.
That's correct.
Okay, so I make motion, sort of along the lines you said, you first, you second, and if possible, me third, where I was last year. But everything else stay the same.
Well,
Well, there's a secretary and treasurer. that
She's
do that.
secretary treasurer.
And
I know you enjoy
Now,
being
you're the
on
treasurer,
finance.
you have to be bumped up to treasurer,
Yes,
okay.
are you gonna do, will you want to
I
step?
would do it, if he would let me,
Who, me? I'd love to work with you, Gene.
You want to be treasurer?
I can be,
So you want to?
yes.
Okay.
It's pretty well.
Are you proposing a slate of officers?
Yes,
What's that?
Okay, what is that? John
John,
is chair. Catherine is first vice.
Catherine's first, and I'm third, or second.
So second vice chair.
Second vice.
I can't be both. You want to be a vice chair and treasurer.
Oh, I can't.
No, gotta be
Okay,
one or the
okay.
other.
Basically,
Then I'll be
treasurer.
treasurer then.
Okay.
Okay.
Third vice would, who wants it? I mean,
Second vice.
Put it this way.
Just figure out who's
Who's the chair?
secretary and the remaining person is,
Sorry, Scott, say again.
just figure out who's secretary and then whoever is left is the.
Secretary.
then you're left, you,
Flip
So-
the coin.
If I'm secretary, then Fred's the second vice.
Put volunteering victim.
and then the committee members, you would decide.
That's correct.
Okay, okay. I make that motion.
I'll second it. I have no problem with that at all.
I'm not secretary yet.
I did. You just say abstain.
Okay,
We have to vote.
yeah.
Well, before you do,
Discussion?
is there a second slate? I mean, that's a slate, but you can have multiple slates.
But
I
you've
thought
got,
we had a
hang
motion
hang
and a
on,
second.
hang on,
Come
you've
on.
got a motion and a second, you gotta
Yeah,
take a
we
vote on
gotta
that
deal
before
with
you
that.
consider others.
That's
If it's
Yeah,
defeated, then you go to another slate.
Jean, your vote?
Yes.
Ross?
Yes.
Fred?
Yes.
John?
Yes.
You guys will pay.
What's your vote?
No.
Mine's no.
Okay.
Mine's no.
Proud.
Hey, I just told you how I felt. Now you'll see. Welcome.
I'm a little scared now, Catherine.
I'm just telling you. I feel
might-
like this. Go ahead.
I might have to Zoom from here on out.
Yeah, I could go either way. Is it because I'm a female?
I think you're gonna show up with a stun gun.
How do
By
I
the
know?
way, thank you for letting me Zoom. There's a fire about 15 miles from my house that we've been watching, so
Oh,
we're fine, but you never know what the winds are gonna do. So thank you for letting me Zoom today.
good luck,
We
Scott.
appreciate it.
Yep, we'll be fine, thanks.
There you go.
Call FEMA.
So any
Well, now,
comments
Scott,
that,
are we gonna, after this, are we gonna? Scott, we're gonna have closed session.
Yes.
yeah. Yes, but we're gonna have director's comments first.
Yeah.
What are you gonna be again? I just wanna verify that you're gonna be treasurer. All right. It should be. So any director's comments? Of items not appearing on the agenda?
I didn't get you pissed off at me, did I?
Nope, but I know where you live.
It's, I really appreciate it. I can't think of a person.
Kelly.
Kelly Brown. It was Steph, and she did it, and I think it was awesome. It had some good discussion. It was good. Nobody's head fell off or anything like that, so it was really good. And Tim didn't get beat up as bad as I thought he might, but he's.
Doesn't feel like it, but
Yeah, he looks like.
Just stay positive, keep it-
fine. Everything is moving forward great.
Yeah.
And I'm glad to be here.
that it?
Yes.
Okay. Ross.
I just want to state for the record that I so value the employees of the district and all that they do. it's an amazing staff. The management team we have is great. Our frontline folks are great. All the support personnel are great. The clinical staff are amazing. I'm glad we had this discussion. It was painful, but I hope it moves us forward and everybody feeling better about working here and actions that we can take into the future to make sure that that happens. Thank you.
Highlight what Ross said. I agree with them completely. The only thing I would like to say is reading that statement by the employees one time highlighted what we discussed in regards to employee morale, part of the team. It concerned me with some of the items they discussed regarding maintenance, so I'm glad it takes so long for some minor items to be addressed. But I think it's critical that they continue to voice their opinion, because if they don't, maybe what they're stating, they feel like it falls on deaf ears. And just hope they keep the momentum rolling. Some regular challenges. Thank you.
John?
Yeah, a couple of things. Well, first of all, even though I'm a share in your advice here, I'm actually looking forward to working with you, especially on the governance committee. I do value your opinion, especially your experience here, and who knows, with some of these things that have came up, maybe we need to have governance committee more regularly. Help maybe monitor some of these things. I don't know, we'll figure that out when we get to 2024. Secondly, Gene brought up during the meeting the format of these meetings. I can't agree with you more. I don't know how the rest of you feel, but I know a few times when I've been here and there has been some people from the public. As an elected public official, I feel like that's offensive to them, because they elected me. I need to face them and have an interaction.
Right?
That's just how I feel.
No, I agree.
They're the ones that put me in this seat. I know some of these employees, maybe they all don't live here, but they pay taxes here. And one way or another, they're supporting our hospital, not just being in. They're spending money out in the community, and I just like that one-on-one. I know we've gotten away from that with COVID, but I like that face-to-face interaction. I'd like to see more employees come here. I'd like to see the public side. It's their hospital. We work for them.
And maybe if we do change the format, they will come.
Possibly.
I mean, I don't know, but
I just feel the few times I've sat on that side of the room, we've had public here, having to do like this, and it's just like, oh, I got my back. I feel like I don't give it to them about what you have to say. I feel terrible. Also,
you could have this turn.
Never gonna hear that, but this is gonna be.
Well, never. 365 days.
The last thing, I was gonna mention it while the employees were here, and I know there was a lot of discussion, and I figured, well, just wait till public or the director's comments, and they're still some. Yeah, but I know some of them that were standing in the back, left, but when I first ran to the seat in 2006, it was like my second or third meeting, and it was in this room. Of course, the room was different then, but there must have been like 20 people standing in this room. I mean, it was standing room only. And this was back in 2006. That's like 18 years ago.
You were young, huh?
Yeah,
I
well,
was so
Sure.
you got in here
We
very,
met in the cafeteria, because I came in 2009.
yeah, this is in 06. We had meetings
Oh,
here,
is that right?
and then when it really got out of,
We took over.
yeah,
Okay.
because when we started having like 60 people from the public show up, then, well, anyway, at this meeting, that's when everything was going down in this building. And staff came to this meeting and said, we followed the chain of command. I know you weren't the CEO.
Yeah.
I followed the chain of command. Our concerns are getting ignored, and you can say whatever you want about Bob Dunn. I know people think he was the worst CEO here when he got on the board. He had a tax line, but he was the only board member that legitimately seemed concerned. maybe that's because he was CEO here and he knew what was going on. It just seemed like it just fell on deaf ears, and then subsequently, months later, that's when it really hit. And CEO resigned, and patients in the SNF passed away, and the state attorney general came in here. I mean, it was a goddamn mess. Sorry,
Yeah.
pardon my language, but
That's $1.
yeah, exactly. But I guess what I'm getting at is, that year that I ran, the staff here, one of their first things was, if you get elected to this seat, will you at least support us? And I says, yes. And after I witnessed what went on in that, one of those first meetings, I always taken that to heart. I know that there's a chain of command, there's policy and procedure that, that they need to follow that, but, I've always taken that to heart since I finally got on this board, that, the employees need to feel like they're valued, they need to feel like they're heard. And this place can't operate without employees. So I guess what I'm getting at. And I know we came a long way since the disaster in the skilled nursing facility, but I just don't want to see us eventually get to a point where we go backwards again. I guess is what I'm kind of getting at. I don't want to see this hospital go through that because of concerns going on within the various departments of the hospital. I think if we address those kind of needs now, and we can certainly overcome it. So that's really all I have.
And there's reasons people don't follow chain of command. Because that could be where the issue is. And so, I mean, it's concerning, because then they feel like who can they go to? Even though we do have a chain of command, that's why I said, there's always the board members, because we have no problems with our dialogue with, you or Mark and getting the point across. Do you need something? You just great, to change your vote. So, it's not.
Catherine, can I
Time to you.
Can I make a comment?
Yes.
Let's make this short. I gotta get out of
It's
here.
gonna be a quick comment. So when I saw that, I was very offended. And since then, since we went through the exercise of answering those things, it's self-reflective for me.
Mhm.
And so, to your point, John, we're not gonna let that happen. I went through that too.
I know, yeah, I agree.
So,
I'm gonna step in here. This is board director on comments not on the agenda. This is not time for free-flowing conversation.
Okay.
So, right, John, I'm not cutting you off. I'm just letting everyone know that this is for board members to talk about their thoughts.
He didn't like your vote either.
Well,
So-
That's right.
That's all I have to say.
All right, and I totally understand that. I just have one thing. I received an email. I think Dina, it went to Dina and maybe Sally also. Maybe I'm talking about the wrong one. From a family member. Did you get one from the family member? Anyway, I got an email from the family member that actually came in the night the ER was closed. And I've been in contact. We've been emailing back and forth. She was very distraught. Her husband had, a medical issue. They felt like they waited for a long time. Yes, the doctor saw them. But then, tried to, I don't know how much I can say, but the doctor couldn't take care of what needed to be done. So he was going to transfer him by ambulance. The family felt that the ambulance wasn't needed. He didn't have a fever. He wasn't in pain, didn't feel like they needed that extra cost. So there was lots of things that kind of went that they were uncomfortable with, the wife, So anyway, I spoke to her a couple different times. I invited her to this board meeting. She declined. They actually had follow-up doctor's appointments from when he was in ER. Ended up having like an emergency surgery to the hospital he went to. But I explained to her that we are a critical access hospital, sent her the definition of critical access hospital, explained, you know, the ambulance was what the doctor felt would be probably best transfer. If not, if it was needed more so, if they would have called a, you know, a helicopter, they would have done whatever it took. I asked, she was grateful for the, you know, quick response. I asked if I could pray for her and her husband. She was, I usually always ask if they're okay with that. And they absolutely were okay with that. And she was very responsive. So I will look and see who else got it. And I can send it to you, I'll have Heidi send it to you guys. But even though we did have it closed and someone was in, I think because her husband was having pain in the beginning and she was concerned, she was able to still reach out and want to know why because she'd been reading on Facebook too, it sounded like. And, you know, it only takes, you can say 100 good things about it, but it only takes, excuse my French, you know, one aw shit and everything else good is wiped away. Everybody focuses on that. And then there was things like from 20 years ago. And I was like, what? Yeah, so anyway, it all worked out. She was happy for the board response because I felt like I was speaking for all of us, but it turned out okay. And I will let her know that I let everyone else know here and administration. But it ended up being a good outcome. So even though we were closed, we did meet, you know, the needs for the most part. She just wasn't happy with no nurse, no, but it's all taken care of. So that's it. So now we're gonna move into closed session because everybody's got something they want to do. All right, you guys, thanks for coming. Thank you. See you later. I'll try to get you on. Thank you.
Oh, I'm looking forward to it, dude. Thank you. You guys.
Okay, go ahead. Closed session report.
All right, so in closed session, council and the board discussed the Benson, Lau, and Rostad matters. There was no update for Volkova and no action was taken.
Thank you. That is the conclusion of the closed session. That brings us to the adjournment of the Kern Valley Board meeting, and it is 4:39. Thank you.
Thank you all.
Have a great day.
Good luck and hopefully,